switch now to CBS 2's Lou Young in Hamilton Heights, where the doctor lives. And Lou, what's the scene there right now?
Well, they're beginning to assure the public, handing out these little cards here to tell people about what to do if they think they might have been in contact with the doctor or have Ebola. The doctor who lives here had been in West Africa treating Ebola patients, and it felt fine, but it wasn't until this morning that he thought he might have been infected as well. Dr. Spencer lives on the 5th floor of this apartment building, one of its entryway doors off its hinges. The cops were in that much of a hurry to get EMS inside and upstairs to his apartment. One of the workers here said he was told to keep us out.
Is there people up there?
No, nobody's there.
Oh, who doesn't want anybody up there?
The police.
The police are up there?
They was here. They break the door.
Are you worried?
About what?
About Ebola?
About Ebola?
Yeah, I do worry, but there's nothing here. The guy is not here anyway.
People from the health department showed up shortly after that, complete with information cards about Ebola. The local city councilman confirmed Dr. Spencer was removed to Bellevue Hospital, and we may not know if any of this is necessary until tomorrow.
But I want the public to understand that we're treating this with great caution, and that city, state, and federal officials have responded with the highest of urgency and are marshaling all the resources they have at their disposal.
In typically New York fashion, neighbors seem unconcerned.
Does this concern you at all?
Nope, not at all. You can't get it through the air, and I have faith in the system, in the public health system, to take care of me if I do get it. There's only one patient that's died, and that's pretty clear that that was due to some unfortunate circumstances surrounding his diagnosis, and everybody else in this country at least is surviving, and I'm not worried about it at all.
Yeah, the disease is not communicable until the symptoms surface. So as the Dr. Craig Spencer was moving around town before he began to feel ill, he was not at risk to pass the disease on to anyone else. It wasn't until those symptoms began to surface, presumably this morning, that he became a risk to others. Now, the people from the health department want to make sure that he wasn't feeling ill perhaps last night and moving around. They're retracing his steps, and they're tracing all his contact, as Marcia mentioned a little earlier. We're live in Hamilton Heights. Lou Young, CBS 2 News.
All right, Lou, thank you.
Dr. Max Gomez here once again to talk about today's developments. This doctor has been here for, what, 7 or 8 days? So everybody wondering, should we be worried? Did he come in contact with things that we've touched or come in contact with people? What do you say to that?
Well, first of all, remember, we don't yet know whether he has, in fact, he has Ebola. Now, that said, Doctors Without Borders, the organization he works for, have been working in countries with Ebola, malaria, and other transmissible diseases for many years. These are trained, experienced workers. Now, the organization says he followed self-monitoring guidelines, and as soon as he developed a fever this morning, he reported it to health officials. Now, he would not have been contagious until he developed symptoms, and Ebola is only transmitted by close contact with bodily fluids. And forgive me for being graphic here, but this is important, bodily fluids such as blood, vomit, and feces. It is not airborne.
All right, so I know that a lot of people, when you say the word Ebola, their ears peak up, you know, no question why.
Sure.
However, I don't think that we can stress this enough. As Lou said, you are not contagious until those symptoms are present. So, as we said, the doctor's been here. What if he's been out and about various restaurants, Upper West Side, East Side, whatever? What do you think?
I think everybody's going to be okay here. Again, an Ebola patient is not contagious until they develop symptoms, which didn't happen until this morning. Now, even if he had some slight symptoms last night, he would have had to bleed or vomit to have any chance of spreading the virus, and then someone would have had to touch that and rub it into an open sore or their eyes, nose, or mouth. Remember, the nurses who contracted Ebola in Dallas came in very close contact with those fluids. So the risk here is as close to zero as you can get. Everybody should remain calm.
I just don't think we can stress that enough, right?
Everybody,
yes.
We're going to be okay.
Yes.
Deep breath, we're going to be okay.
Okay, you bet. Thank you, Doctor.